to Well Within Reach. And today we're going to be talking about African American male wellness. We have three special guests with us today. We have Dr. Keith Leapart, who is the Enterprise Executive Vice President, and he is the Chief Health Equity and Community Impact Officer. We have Reverend Leroy Miles, who is Associate Professor in Pastoral Care and Counseling, which includes all things health at the Enon Tabernacle Baptist Church. And we also have Claude Regis, who is a medical student at the Thomas Jefferson University Sidney Kimball Medical School. And he's a medical college, and he's also the president of the Jefferson chapter of Black Men in White Coats. So, gentlemen, we thank you for being here with us today. Now, we want to touch on three major issues today. The first thing we want to talk about is what are the major health concerns or health issues for African American men in compared to some other groups? That's the first thing. The second thing we want to look at is what are some of the challenges, some of the barriers to African American men maintaining their health, seeking out care. And then the last thing we want to do is talk about, in your experience, what has been some of the successful things that have happened, some of the successful interventions and strategies you yourself may have participated in to sort of promote men's health.
The thing I think about the most when it comes to Black men particularly, and it may be because of my age, I think a lot about cancer and specifically about prostate cancer, and knowing that that is the number one cancer in Black men. I think about the fact that many African American men are often concerned about getting their prostate checked. I think there's been a stigma around the way the standard of care used to be, where a doctor would have to glove up and do a rectal examination to feel for your prostate, but that has since changed. So we're now really just getting a blood test. Your PSA is the standard of care. So just as you would get screen to see if you have your hemoglobin A1C or your blood count or anything like that. Your creatinine function is all through your blood now. You can do that for your prostate, and many men are neglecting that. I think we have to do a better job of communicating, one, that it is just a blood test and the importance of that test. Because if you catch it early, it's really manageable. In medical school, they used to teach, you shouldn't die from prostate cancer. You typically will die with prostate cancer. And so that's something that I think we need to talk more about in our community.
Absolutely. I mean, I agree 100%. Prostate cancer, colorectal cancer is another one. When I think about some of the disorders or diseases that, disproportionately affect African American men, I think about things like hypertension, diabetes, and those, unfortunately I should say fortunately, are very preventable. But unfortunately, within our communities, we face, disproportionate rates of, adverse outcomes because of those things. We can get into in the next question about common barriers, but I think, hypertension, diabetes, those things are all preventable just from, simple lifestyle changes, prevention, having a primary care physician. Those things are really important.
And I'll echo you all as well. And for me, heart disease, I do know it's the number one killer. There was a study done in 2016 entitled Brotherly Love by the health department. And they were looking at Black men specifically in Philadelphia. Homicide was a significant issue as a health risk, but heart disease was number one, lung cancer, prostate, those types of things. That's 2016. I would be interested to do a study today and see if those things still ring true. And just as a caveat, the study revealed that the average life expectancy for Black men in Philadelphia was only 69 years of age. And so as a 60-year-old Black man, that is scary to me. Of course, our other counterparts, their numbers are a little higher, but that drives me day in and day out.
The next part of what I wanted to talk about is, what are some of the strategies? Let's talk about, before we get to the strategies, how about the barriers, the challenges? What do you think men are struggling with when it comes down to seeking help or promoting their health?
I'll just start with just my immediate friend group. And, I have lots of Black male friends, whether it's just through social networks or through, fraternity or I went to college with, and we're on different text threads. And the one common theme often is, people are fearful. Like it's oftentimes, I always equate it to getting on the scale. When I'm out of shape and I'm overweight, I never want to go on the scale. The scale is in my bathroom every day. I walk past it every morning, but it's like an accountability thing. And oftentimes, as black men, many of them I've seen is just they just don't want to know. And I'm encouraging them now to go to the doctor. It's best to be able to address it and know. I mean, Claude talked about colon cancer. When Chadwick Boseman passed away, that was one of the big things that blew up in the chat. We got Black Panther, Wakanda King, who, unfortunately, died from colon cancer at a young age, and that woke me up and said, "Wait, I was in my mid 40s at that point, and I was like, yo, I need to get my colonoscopy," and that became something we talked a lot about. So I think part of it is just a little bit of bravado, right? That we're indestructible. We think about when we were in such great shape, and we think about the days when we were playing football and basketball, and oftentimes we didn't even want to get our blood pressure taken. I was just talking to a friend yesterday and encouraged him to go to the doctor, and he's like, "No, I gotta wait. I gotta get my blood pressure down before I go." I said, "No, that's why you go. You go so you can figure out what's wrong and get on the right medication." I get that there is a great degree of mistrust in communities for healthcare in general, right? You think about going to the doctor, you think about some of the historical precedents that existed, but I often say that is why it is really so important for us to partner with community-based organizations, faith-based organizations. It's important that Enon has been doing the work that they've been doing to help break down the stigma, the barriers. It comes a lot more authentic coming from Reverend Miles, who has been with these brothers and men in the community for many, many years and beating the same drum, just versus someone coming from the outside and saying, "Hey, we need to check your prostate," or "We need to check you for kidney disease," or something like that.
Absolutely. I mean, hesitancy, mistrust, delayed engagement with preventative care. I think those are all, very, very pertinent topics. But I mean, one of the things that comes to me when we talk about barriers, my first thought falls under this umbrella, what they call social determinants of health, right? So things like financial constraints, lack of insurance, inflexible work schedules, or um, transportation issues. Those are all things that sort of things that people maybe don't often think about within the context of healthcare, but can be major barriers to simply just going to a primary care physician. So somebody might have the desire, let's say somebody, Dr. Leapart convinced one of his friends or somebody in his community to finally get over that barrier of mistrust or hesitancy. But once they get to that point, do they have the means to get there? So do they have insurance? Do they have transportation? Those are all things that are really, really important and can be major roadblocks to just getting a simple checkup.
And I echo everything that was shared when the actor Pat passed away. On our man thread, it was the exact same thing. Like, man, if he passed away early, the rest of us certainly don't have a shot. But we do try to live out loud. We try to live before persons, honestly. And I agree with all that was said. But the one piece um, that I'll say is, at times we tend to, as men, view self-care as selfish. And we know that's not true, but taking the time out to do those things that are important to care for ourselves as we care for others. I mean, there's a lot of pressure on us to perform, to lead, to show up. And of course, you can't pour from an empty pitcher. And so taking the time out daily, weekly, monthly, if you will, is super important. And we tend to believe we don't have the time. And if you don't prevent it, it will catch up to you. It will take its time from you. And so super important to encourage men to shift the mindset again around caring for yourself as you care for others. I think is a big deal and something we don't talk enough about as well.
No, thank you, gentlemen, for that. And lastly, what has been, some things that you found to be successful, some strategies or interventions that you've used either in your practice or in the community to promote health among African American men?
I'll state again, I think it's so important to work with community partners to come outside the walls of the health system, right? To meet people where they are. And so whether that is in the church or a barber shop or just, in community-based organization, we've just done at Jefferson a partnership with Philadelphia Youth Basketball Organization. And people want to say, well, why are you doing this with this, this youth serving basketball organization? And one, it's a convenient place where many young kids and their parents come. And so, like, how do you bring care to where they are in communities? How do you bring awareness around, the importance of checking your blood pressure, making sure you're eating healthy and nutritious food? You have to do an environment where they're comfortable with. There is something called white coat syndrome where, people will go to the doctor's office and immediately their blood pressure shoot up. So just imagine the fear that comes where um, with people when they have to come to you, come to this office, come to this facility that they're uncomfortable with, versus trying to take these messages around health and education and well-being in the community. And so that's on a broader level. But I would also say, like, one-to-one combat is so important. Often now, when I am seeing, some of my friends or someone who I hadn't seen in a long time, I am asking them a question. It sounds weird. Hey, have you had a colonoscopy? Have you gotten your prostate check? And they're looking at me like I'm crazy, but they get it. They understand that I'm asking that question because it is something important to ask, and so we need to be holding each other accountable. As men, as Black men, knowing that, as Reverend Miles said, we often do not value self care or take the time to perform self care. There's also a note that women in general make most of the healthcare decisions. So, if you're not in a loving relationship or you don't have a partner, often sometimes your partner is the one pushing you to go see the doctor. It's not you thinking about it. And so your partner is saying, hey, we got these kids, we got this family, I need you around. And that forces sometimes men to do it. And so I think we have to look at both at the holistic community level, great partnerships with community-based organizations, then what we can do individually, and then also realizing the role that the women in our lives have in our overall health and well-being.
Absolutely. I mean, I couldn't have said it any better. Adding on to what Dr. Liepard said, I think uh, one of the best options for sort of addressing some of these issues is educating yourself, right? Black men, I think education can be, at any level, can be sort of the vehicle through which you can make great, sort of well-informed decisions, right? So, whatever, means of media that you use, whether that be reading or watching YouTube videos or podcasts, I think are a great option, a great way to, what are my options for treating my blood pressure? What are my options for getting my PSA or my prostate screened, right? So for example, my father, now that he's retired, he's watching a lot of YouTube now. He watches a lot of YouTube videos, and I try to send him a lot of YouTube videos on, different things he should be eating or shouldn't be eating and why that is, right? Just, meeting people where they are, exactly what Dr. Liepard said. If you're someone who drives a lot for work, the next time you see your doctor, you can ask, hey, doctor, do you recommend any podcasts about this particular issue or, anything that, you think that I should be, read up on. So I think education is a major key there.
Uh, Again, echoing everything that's shared, collaboration key. We're going into year 18 with the Men's Know Your Numbers event, and we found now that a lot of guys do use that men's event as an annual. We have an EMR, we track their records, we track their progression. When they leave for that day, they get a one pager showing their basic metabolic screenings, in addition to, of course, getting the lab screening with LabCorp. So that part works. We know it works. We create a safe environment, the man cave, the barbershops, the pinochle, all those backgammon, all those things that the brothers do. So that's super important. And then for me, I am a bit of a nerd. I think I missed a calling going to medical school. So I am using AI, I gotta admit. I'm doing a deep dive with this stuff, man. I'm taking my labs, I'm sharing it on this AI thread, talking about food and exercise and Metcon training and EPOC and all those things that come with working out, because I am the elder statesman on the call. So, y'all are talking about colonoscopies. I'm up for my third colonoscopy, if that gives you any indication of how old I am, for sure. But we also understand that not everyone has that ability. So when you're talking about Dr. Liepard about colon cancer and those things, so we're offering fit tests routinely. at our church. Still trying to get a relationship with Colder Guard to get them to come in and do some stuff with us. But we try to create this ecosystem. I think is the best word around health and wellness, so it becomes routine. And we are finding that men in our little world, our little ecosystem in this big bad city, are becoming healthier. They're owning their health. They're learning how to advocate for themselves, ask all the right questions. And if you happen to become ill, because their wellness is improved, it improves outcomes. We're also having conversations around that next level piece around clinical trials and things, just really encouraging folks to be open-minded and extremely proactive in owning their health.
Wow, you guys have said a lot in a little bit of time. I just want to thank you all for being here with us. And this is not the end of this discussion. We want to continue talking about African American health and men health and wellness, because we know this is a very important topic. I want to say that I think each and every one of you joining us today is a walking, talking, living example of promoting good health in the Black community, especially among men. So I want to thank each and one of you for what you do on a day-to-day basis to help improve the lives of men in this city, and probably even nationally and maybe internationally. So I just want to thank you all for being here with us today. And anybody want to say anything, any last words? We can go around and everybody can give us like one last little statement.
I'll say thank you, of course, Neva, for all the work that you've done with Frazier and really focusing on the North Philadelphia community, which is some of our most vulnerable citizens. And so really appreciate you for that. Appreciate the partnership with the Black Men and White Coats, of course, at Jefferson, as well as Enon Tabernacle. And, this work happens collaboratively. We have to take it one day at a time, realize that, despite all of the concerns that we're talking about health, that Black men have stressors all over the place, and so we got to figure out how do we get them to focus on their health while dealing with all these external stressors. We know it's not easy, but we'll continue to fight the fight.
Absolutely, yeah. Last thing for me, again, thank you for having us. Thank you, giving us this platform to talk about some really important topics. One thing I want to sneak in there at the 11th hour is, addressing mental health, right? Like, I think another thing that is, that has a lot of stigma attached to it in our communities is mental health. So, don't sleep on addressing that mental health, those stress busters, leaning on your tribe, speak to people that, you trust, and, making sure that you're not going at this thing that we call life alone, I think is really important. But again, thank you again for having us.
Yeah. And I'll thank you as well. And I agree. Here again, echoing all of that is, and so not just one man thread, but I actually have 4 different threads that we keep track of each other. And you're right, mental health, mental wellness, super important, which we've added over the years to the Men's Know Your Numbers, depression screening, and just having those types of conversations. And for me, I do try to live out loud. I think because of the relationships that I have, men give me permission to kind of holler at them, like, come on, man. Like Keyshawn Johnson from the NFL, come on, man. But we live out loud, we talk about it. So for me, it's 1 hour a day, 1 day a week, 1 week a month, 1 month a year that I am specifically addressing my health. And I don't apologize for it. I don't run from it. I know not everyone has that ability to do that, but just don't hate me because I have a great job and I've been on it for 30 years. So it comes with a level of flexibility. But again, 1 hour a day, 1 day a week, 1 week a year, 1 week a month, and then 1 month a year that we're focusing specifically on self-care. Self-care is not selfish. Thank you.
Thank you.